Urgent fetal surgery is a form of surgery on the unborn fetus. It is used to correct medical problems and can help to improve outcomes. Common reasons for performing urgent fetal surgery include abnormalities in development, growth, circulatory and organ function. It involves operating on the fetus while still in the womb through a variety of techniques, including open surgery, laser ablation, laparoscopy and endoscopic fetal surgery. Prenatal diagnosis is used to identify conditions that may warrant urgent fetal surgery before the birth of the baby. As with any type of surgery, there are always risks involved and potential complications. Ultrasound scans are used before the procedure to assess the baby's development and check for any problems. The type of surgery required depends on the condition being corrected and is most often performed before the 25th week of pregnancy. It is performed under general anesthesia with the baby carefully monitored throughout the operation. After the procedure, the baby is usually kept in an incubator and monitored for any potential post-operative complications. It is important to seek out a specialist in fetal surgery, who are experienced in this complex and sensitive area of medicine. Advantages of urgent fetal surgery include improved outcomes for the baby, the possibility of avoiding a high-risk birth and better quality of life in the long term. Potential risks of the procedure include infection, bleeding, damage to the uterus and preterm labor. Follow-up care after fetal surgery is essential to identify any complications or early signs of ill health in the baby. Urgent fetal surgery can be a life-saving procedure for a fetus with a medical condition that can be corrected during the pregnancy. Before the procedure, it is important to discuss with the doctor any ethical or religious considerations that may need to be taken into account. The risks and benefits of proceeding with the surgery need to be carefully weighed up before the decision is made. Parents should prepare themselves for the possibility of a long recovery time for the baby after the procedure has been completed. To ensure the best outcome, it is important that the parents and medical team are all in agreement with the decision to go ahead with the surgery. Urgent fetal surgery is still relatively new and is not available in all countries. Where it is available, there are strict medical criteria to meet before it may be performed, and careful consideration needs to be given to whether it is the right course of action for the baby. As the procedure carries risk, it should only be performed when the benefits clearly outweigh the risks. It is essential that the baby be monitored after the surgery and that follow-up visits and tests be conducted to ensure the baby is not suffering from any post-operative complications. It is also important for expecting parents to have continued discussions with the doctor throughout the pregnancy so that plans can be adjusted if needed. Urgent fetal surgery can be an effective treatment for some medical conditions, but there are always risks involved that must be weighed up. Careful management of the pregnancy by experienced medical professionals is of the utmost importance to ensure the best outcome for both the baby and the mother.